So I get this question a whole lot from women who have just started on hormone replacement therapy. Most of these women are in menopause and they may not have had a period for 1, 2, 3, maybe 5 years or more. But all of a sudden, when they go on hormone replacement therapy, they experience spotting, breakthrough bleeding, or sometimes even what seems like a full-on menstrual period. So what is that woman supposed to do? I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those are about hormones and hormone optimization. There are lots of other things that you can use for menopause symptoms, but the only way to reduce or maybe even eliminate all of those symptoms and reduce your health risks at the same time is by optimizing your hormone levels. I've got lots of other videos about that. But what happens when you start on hormone replacement therapy and you maybe experience some of the relief from symptoms right away, but you get this vaginal bleeding that seems to come out of nowhere? Well, I'm not a doctor, and so you can't take this as medical advice. This is only educational and informational. However, the providers that I work with, in general, have a very simple solution for that out-of-nowhere bleeding that takes place once you get on hormone replacement therapy. Most commonly, the bleeding is caused by too low levels of progesterone. So when a woman takes hormone replacement therapy, let's say for the simplest case, it's a woman who has never had a hysterectomy. That woman has an intact uterus and ovaries, but the ovaries have shut down because of menopause. And that woman is experiencing all kinds of symptoms of menopause. So the provider has placed her on estradiol and progesterone. That's the most common, most effective, and safest treatment for menopause symptoms. It's the one that I recommend the most. However, a lot of times women will be started on a low dose of progesterone, say 100 milligrams. Very commonly, that's not enough to stop bleeding. And so you can get some spotting or breakthrough bleeding or even more serious bleeding. Of course, anytime you have serious bleeding issues, it's something to consult with your healthcare practitioner about, because obviously if you're bleeding too much and for too long, it can be a serious problem. But the solution many times is to increase the dosage of the progesterone. So that 100 milligrams of progesterone may not be enough. Sometimes 200 milligrams is enough. Sometimes 300 milligrams or 400 milligrams, maybe even higher, may be needed in order to stop that bleeding. There's also a bit of patience. This is not something that you can necessarily expect to go away in one day. It may take a couple of weeks in order to find the right dosage of estradiol and progesterone for your particular situation. So my recommendation is if you experience bleeding after starting on hormone replacement therapy, have your doctor check on your progesterone level and maybe increase the progesterone and see if that doesn't make a difference. Now, clearly, as a warning, there are other factors that can cause vaginal bleeding, and so your doctor will probably want to rule those out in most cases. Often there's something called a uterine ultrasound that can check on the lining of the uterus called the endometrium, and that's something that is a routine check to make sure that it's not overgrown, and that can lead to vaginal bleeding that can be a serious issue. There are other issues that could cause vaginal bleeding, but in general, after you start hormone replacement therapy, the most likely cause is probably a low level of progesterone, which is relatively simple and straightforward to change. I would also let you know that when you do increase the dosage of progesterone, it is possible to experience some side effects. A higher dosage of progesterone, especially oral micronized progesterone, can cause more nausea. It can also cause quite a bit of drowsiness. If you take that dose at bedtime, there may be some hangover effect where you are drowsy into the next day up until 9, 10 in the morning. So it is something to be aware of and to kind of talk with your provider about. Now, one other thing that I would mention about progesterone is, especially if you intend to treat this on your own, there are forms of progesterone that are available over the counter in transdermal creams. Those are, in my informed opinion, very ineffective in treating this type of vaginal bleeding. So I would caution you against using a transdermal progesterone cream in that circumstance. If you like this video, be sure to click the like and subscribe buttons and click the little bell to make sure you get notified anytime I post a new one. Thanks so much for watching, and I'll look forward to talking to you again soon.